Hi, my name is Erin Fitzpatrick, and I'm with the Pine Community Health Center, and I'm their Director of Quality Improvement.
Nice, welcome.
Thank you.
Is there anyone else on the phone? Okay, so I'll go next. My name is Arvinder Singh. I'm the Community Health Coordinator for Lake Health District, Lake County.
I'm Nam Dave. I'm the Clinics Director with Lake Health District.
My name is Anna. I'm a PhD student at Oregon State University at the Department of Applied Anthropology. And I'm taking a class on ethnographic work. And I'm with my friends. Yeah. They told me about this meeting a few minutes ago, and I'm here.
That's awesome. Very
yeah.
good.
Thank you.
My name is Andrew. I'm also part of the Oregon State Group, and I'm an undergrad anthropology student.
Hi, I'm Tiana Nevin. I'm also part of the Oregon State Anthropology Group. Thank you so much for having us all.
You're welcome.
Paul McGinnis, Eastern Oregon Coordinated Care Organization.
James Williams, Lake County Commissioner.
Kristen Hill, Hospital Patient Navigator.
Andy Thompson, also part of the OSU PhD anthropology.
Johnny Nelson, first year PhD student here, and also the last part of the Oregon State University. Very nice to meet you. It's nice to meet you.
Judy Clark, Director of Public Health.
Carl Johnson, Town of Lakeview County. I've got Johnny and Andy both staying with us.
Oh, nice.
I invite them to our meeting.
I'm Daphne Greer with the Council on Aging as well as the South Central Early Learning Hub.
I'm Diane Clay and I'm a consumer advocate.
And I'm Cece Montgomery and I'm CHIPS and plain old citizen.
And we have a new staff from the Examiner. Do you want to introduce yourself?
I'm Teresa Poland. I've been here about 2 months now, but my sister Rhonda Penaloza has lived here many years, and my uncle Glenn Bogart. So I'm well familiar with Lakeview, and we are glad to be here.
Okay. So welcome.
Oh, me, Christy Alderson, hello. I'm the grant writer for the Health District.
So I think we can go ahead with the agenda items. Again, about the minutes, I don't have the minutes for the August meeting. There was an error in recording the minutes, so I apologize, but it won't happen again. So I think we'll just go ahead and start with the agenda items. Paul, do you want to start with the incentive progress?
We'll start with the, for our guests, the tables. We'll go to the one that says Lake County. It's the third one in at the top. And review, but for your information, the coordinated care organizations, the Oregon Health Authority withholds about 5% of our global budget, which is about $12.6 million, and says you need to perform and meet these measures on this table, plus some others, in order to get that $12.6 million back. Last year we were able to get it all back. The year before we got back all of it. The year before that only 80% of it. So it's an important factor because the money that comes back pays primary care for quality services, recognizes the patient-centered primary care homes, and also funds activities of this group, as well as some other grant options that are available to the community. So this is through July, so there's no big claims write-off. This was as the claims were dead on the last day of July. So we're hoping over the next couple months that we're starting to see some of those colors turn green and move forward on that. The way you look at this table, for the first measure it says adolescent well-care visits. These are expecting teens and young people ages 13 to 21 to go in to a doctor's office, be examined physically, evaluated mentally. you know, and for substance abuse, sexual practices, those kinds of things. So that's what it is. So if you look over there, under 219, there's 301 in the denominator of people who meet that criteria in Lake County. 50 of them have had that adolescent well child visit. So in the last column, there's actual number of how many more of those events you need to bill for in order to meet that child measure. I don't think we're going to be able to do, Judy, the childhood immunizations. It's just, we're almost too far behind already.
Yeah, right?
Right. I mean, because those 24 kids turned 2
Right.
in the beginning part of the year, and
So
only 15 of them were fully immunized.
Some they're out of our area, and it doesn't, we took them out of alert because they moved away, but they're still showing up.
You can clean that data up with Sarah and Courtney and reconcile it at the end.
Okay.
You know, we definitely need to know that.
Yeah.
The other issue that goes with that is we might be still getting paid for them though.
Oh.
You know, even though they've left the area, if
Right.
they inform the health authority, they think we have
Right.
a 0 to
So
1
from
year old.
the public health standpoint, I don't do anything with that except communicate that I can't, I got a hold of them and they said they no longer live in the area, they're out of state or whatever. I just take them out of my alert system as inactive, but they're still showing up. So I'm not sure what I do with that in public health, or do I just communicate that with NOM who they're under their.
I think, Judy, if you give me their names, I can send an email to Sarah and Courtney and work with them, because I have a few other patients on other measures that fall into that same type of criteria.
Do you have a way of finding out where they go?
So, no, the problem is, all I have, because they're not my clients, all I have is a number that they gave me at some point in time, and none of them work. Everybody's phones are turned off, or they make an appointment and they cancel. I have no way, they're not in school. I can't get to them until they get to school. When they're at school, I know where they are, and I don't need a parent, but we just struggle with getting a hold of them and having them come in. If we can find a number, we work with the clinic, we're able to get in and look at a parent's number and see if we can do that. The problem I've had with that is the emails aren't set up, so you can't leave them a message, they don't answer the phone. Yeah, it's just a hardship. Yeah. It's really disappointing, because I thought we were going to possibly get it this
Yeah.
time. Yeah.
So working our way down the list, we still have you're still doing the FIT test this year, right?
Yeah.
So that's for the colorectal cancer screening. When is the big mail? Or is it
So
out?
we are doing our introductory mail is going out next week.
Okay.
That's the first letter that will be sent.
So we should see a bump in that as it goes. The same with the dental seals. You know, the advantage will be in the schools and that kind of stuff over starting soon, so those should come up as well.
I have a quick question.
Sure.
What is the PCP care? My
At the bottom?
Yeah.
That's not actually an incentive measure, but the RCAC, the Regional Community Advisory Council, wanted to emphasize that it's very difficult to meet these measures when 35% of our members don't use any services at all. So this is just a gentle reminder to the clinicians that at this point, you know, only 56.6% of the members have used primary care services.
Okay.
Yeah, out of the 2,000 members in Lake County, or 1,900, something like that. So that one and the morphine equivalent doses are just on the report to keep us in mind, but they're not incentive measures that are tied and linked to money. The oral evaluations for adults with diabetes is going to be very problematic. 108 people there, and the real problem is access to dental services at all. The same data looks the same way in Baker County, where Advantage was not able to get a dentist in, because that one can't be performed by an advanced practice hygienist. It must be done by a dentist. So anyway, let's hope we start seeing some changes on that. And again, as a reminder from the last meeting, that DHS custody went about 4 down. Kids in Department of Human Services custody it's just totally wrong. We know the numbers are way too low in some of our places. So any questions on our progress?
A question on the oral evaluation. Do you think the number of patients with diabetes is 108 in the county? Do you think that's accurate? Or that might be
I would have guessed there would have been more.
Right.
But that's what we have as a denominator. But if they, well, I don't know how far back they go, but I mean, typically diabetics seek care, right? So they're part of that 56.6% that have been in. So, you know, I was gonna say maybe they weren't the ones that went in there, but then you wouldn't know if they were diabetic or not. They wouldn't be diagnosed. So if they were diagnosed 2 years ago and we haven't seen them, could be a problem.
Quick question, does the healthcare system here have a mobile clinic?
I don't,
Mobile dental clinic or primary care clinic?
Either, yeah.
I thought at some point there was a mobile clinic, dental clinic, but we have never had a primary care clinic.
To be fair, Advantage Dental is currently in a building with wheels. It's a trailer, parking lot.
But for people that have diabetes, is it possible that there's like a homebound issue and a lack of transportation?
well, if they have the Oregon Health Plan, we have non-emergency medical transportation and it's a free ride to WIC services as well as any in-county or out-of-county primary care or hospital service. So transportation shouldn't be a barrier if somebody picks up the phone and schedules an appointment. Okay, so the next part for me is a list of talking points that's written down there. Estelle is on the phone, she can, go ahead.
A quick question on the effects of contraceptive use. It's been broken into 2 different pieces. Age 15 to 17, 18 to 50.
Yep.
The age 15 to 17 looks like we met that at 39%, where the targeted rate was 35. But you jump down to the next one, down here, and it says that the members to meet the target is 51.
Well,
but that doesn't seem to correlate. I'm trying to understand exactly what is the actual number that you're going for when you actually see under just effective contraceptive use, the members to meet the target is only 45.
yeah, because you combine them both. James.
Yeah, but the other one is only 0.
Because we've already done enough of the 15.
So is that 51 even accurate?
17.
Okay, but is 51 accurate? Are you going for 45 or 51? That's one.
So to get to 58%, we need 51 more people, and we only have 111 right now.
But under the entirety of the statistics, it says only 45.
I'm not sure.
2 more up. You go 51, up above that, 0, and then the one up above that is 45.
And that means we're probably exceeding the other one by 6 people.
Right.
Okay,
The
so
younger bracket
that's what I'm trying to clarify. So 45 actually,
is what we still need. Yeah.
but we actually need
to have it
51.
combined.
But we need 51.
So we had 6 more
Yeah, we have
15 to
6.
17-year-olds
They
than we
need-
needed.
Right.
I'm just saying, which one are we going for there?
Right. And I think you were out of town, that measure's going away in 2020.
Oh, okay.
We're actually meeting the measure, but that's what the physicians complained about most, was when they expanded it to 15-year-olds, they said, we're trained to do no harm, and if somebody tells me they're not sexually active, why am I putting them on a long-lasting contraceptive?
Got it.
So,
Yeah, no,
I mean, a lot of people were fighting about that, so the health authority actually got rid of it for 2010, the whole measure. Although still, over half of pregnancies in Oregon are unplanned.
Right.
Among everybody, not just Medicaid. So, did that help?
yes, it does. I just had to clarify. I understand.
No, that's why we're bringing it. So, Estella's on the phone. We sent her some materials around when and how we were going to conduct CCO 2.0 community presentations. This is a requirement of our new contract. We must have a meeting in each county that we serve, so we're having 13 meetings, one in each county and one at the end of this month at the Regional Community Advisory Council, looking for some feedback on the presentation before we start wheeling it out to everybody. At first we thought it was due by October 1st, but then we learned it's December 1. So the meeting for Lake County will occur here in the Penn Wilbur Room, November 14th at our regular CHIP time. And we'll need another half hour. It'll be from 3 to 5. But the presenters will either be the COO of Chief Operating Officer of the EOCCO, Robin Richardson, the President, Sean Jessup, or the Chief Executive Officer, Kevin Campbell. During these meetings, again, we'll provide the 30 days notice of location, time, and get the agenda to Estella. We have the same agenda pretty much for each place. But we're also required to seek input, and that's what I'm doing right now, on any subject matters that you want to see addressed that concern you about the Oregon Health Plan and the EOCCO in Lake County. So for instance, Baker County wants to talk about dental access. You can actually see the numbers in their emergency room going up for people coming in with non-traumatic oral health complaints. It's just, you get, in months, you can just see it going up because they have no access to services. Harney County dental providers and physical health providers want the CCO to talk about how we can actually get people to use services more. You know, that PCP count. It's like, how are we supposed to do this? And oral health providers are being held to a higher standard, I believe, next year, which is that they want at least 50% of their members to have had a service. And that's not the case with oral health services. Gillum County, they want to know what the CCO is going to do with adolescents that are in DHS custody that need high levels of service, whether it's residential substance abuse treatment, you know, they're having gender identity issues, so high-level stuff like that. Sherman County's interested in contracts with providers in Hood River who wouldn't sign contracts with the EOCCO. I'm not sure what we can do about it, but they want to talk about it. So if there's something that you all are interested in, now's the time, because we're required to let Estella know that we have an open chance to get something on the agenda.
So Paul, how many presentations are we looking at?
You mean for Lake?
Yes.
One.
Okay.
Just here at one time.
So that's,
go ahead. Go ahead.
sorry, so that's what the extra half an hour is for?
Well, there's public comments too.
Okay.
And then
Okay.
the main presentation, I'll get to what we're required to talk about and what we will talk about in addition to.
Yeah, I was just trying to find out if we will have a normal CHIP meeting with the agenda and the presentations, or the presentations will be the whole thing, right?
Well, I would try to get some business done if I was you.
Yeah.
But keep it short at the end of the public meeting.
Ms. Paul?
Yes.
This is Del. All the information was sent out to Bell Shepherd, the other innovator agent, of the dates and the agenda. So that's been taken care of already.
Thank you, appreciate it. And, you know, some of our CACs haven't met this month, so we're planning ahead. Our vendor was kind enough to confirm ahead so that we could meet this deadline requirement. But I believe Troy has at the top of that tentative schedule.
Yes.
Okay.
I have a concern for Lake specifically, Paul, just thinking about, we're unique among even the other larger counties. Hardin County, more or less, everybody is in Burns, Hines. Down here, everyone can get to Ontario, Vail, Nissa, they're all right there, and they have the outliers. We have 1,000 people in North Lake, so one meeting in Lakeview, I have a problem with that, I guess. Just that, as far as health equity goes, and how do we get our North End folks involved?
Well, that's a good thing. I mean, the bullet down below, the discussion, we had to talk about getting people to the meetings in unique ways in Lake to get the word out. I think that we could probably do something remotely, if that would help. And we have the North Lake people on board, but they don't know what the meeting subject is yet, so.
Right.
But I'll certainly, we could probably do something like that. It would help. But concerns about the health plan. We can come back to it, or we could say there was no comments, so we'll go from there.
I think for my part, I know for eating utilization, we've been collaborating with NOMS, we still have a hard time getting patients in to see their PCP in a timely manner. And just being overbooked and having a really long time before they can.
Oh, you mean just availability of workforce?
Availability of our providers to meet this group.
Okay.
Because in this, there's so much extra time that our providers are having to spend with patients and extra things that they need to do when there's things emergent that need addressed as well.
Right. So overall, we're required to talk about 4 different areas. We are expected to communicate these things at about an 8th grade level so that people understand, but in all honesty, these first indented areas are things that even PhD candidates can debate what the actual meaning is. So value-based payments. Essentially that's changing the way you all are going to get paid for any of the services that you get. By 2024, we're supposed to be paying out 75% of our $390 million under value-based contracts, so it's a stepped-up system. The incentive measure money that NOMS Clinic gets specifically and the North Lake Clinic, Lapine gets specifically, is going to shift next year. Rather than sending them the $23 per member per month, just as a check to start the month, that's going to be reduced and more will be put onto the quality measures in terms of the total. So other ways that we have risk sharing with our member hospitals and that kind of stuff will go under that topic of value-based payments. Health information technology, we'll talk about the platforms that we have in place and where we see that data going. And I'm assuming you're using pre-manage and all that stuff and trying to make that work. Here's one that people will struggle with: social determinants of health and health equity. So the authority has not let us know exactly what we're supposed to do with housing, but we're supposed to be supporting housing in 2020 somehow. Whether that's a percentage of our global budget or a percentage of our revenues, which means that we wouldn't know if we had any revenues, or costs over expenses till the end of 2020 and apply it to that. But more than likely, at a minimum, it would be supportive housing for people with severe persistent mental illness, maybe special targeted populations, single moms that are pregnant, veterans, something like that. Veterans typically are not our OHP members, and these dollars have to go to Medicaid recipients. Okay. So.
We have an exciting opportunity for you, potentially, just
Okay,
later.
great.
You may be driving home late tonight.
So, on the health equity piece, we're supposed to have a health equity plan. I'm in favor of this, but one of our problems statistically is that in many of our counties, including Lake, the data is often suppressed.
Yeah.
Even in the behavioral risk factor surveillance system, you know, for the entire population, the data is suppressed because the numbers are too small. But if you start adding a category of race or ethnicity to the data bits in, you know, Wheeler County, all 1,200 people, it's pretty easy to figure out who it is. And, you know, so it's protected. We'll be able to get data across the system, which may or may not be interesting, you know, but people in many of the counties look at it and go, that's not us, you know, so why motivate you to do that, you know? It's like being in Reedsport in Douglas County. They see Douglas County data and they go, this is not our town. You know, our kids don't do that. It's Roseburg. And then the last one is on behavioral health. I mean, we're really supposed to be pushing integrated behavioral health in primary care. And it will be scary for our community mental health programs. So Trace Wanzer's program here that the hospital has done, they're no longer going to be able to get a capitated payment.
Oh, from Gobi?
From Gobi.
Okay. Interesting.
Wow.
We're going to be required to pay any licensed mental health person. So that actually hurts it's getting to 75% of value-based payment too, because a capitated payment is value-based. I give you a certain amount of money and you don't really know how much work you're going to have to do, and you get to keep that, whether it's, you know, obviously there's some checks that make sure you're doing some work, you know, utilization reviews and things like that, but yeah, our community mental health programs are really kind of, they need to be worded. Because what will likely happen in my mind, this is just my opinion, is that primary care will get anxiety, low levels of depression, but people with severe and persistent mental illness, people that are bipolar or schizophrenic, are what's going to be left for the CMHPs. You know, it's going to bifurcate the system for the levels of different mental illness and behavioral health changes. I mean, because you can, if you had a licensed clinical social worker and they're working with somebody on their marriage and family counseling within primary care, or, you know, diet and exercise, you know, diabetes management, those kinds of things, and that's stuff primary care wants to do, and it's a great setting to do it, but it's not going to be for people who are severe and persistent. So anyway, we'll talk about that. The additional topics, we'll have a slide about all the dollars that have been invested here in Lake County over the first 6 years. Hopefully somebody here would be able to articulate with us on that little slide on the agenda, but we can figure out who that is later. If you noticed, I think I said this at the last meeting, I didn't say Paul McGinnis Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization. I just said Eastern Oregon Coordinated Care Organization. So, the Health Authority does not want it to be MODA employees and Gobi employees. We have to be EOCCO employees and brand ourselves that way. So
why is that? Just because they don't want it? I mean, is there any kind of logic behind that?
Hey, Estella, that is a good question. Why
Can you repeat the question?
why does the Health Authority want us to not have, I think, is it branding or what? You know, not have MODA people, not have MODA people and not have Gobi people.
Yeah, I think their thinking was they want to have just one umbrella with everything. This way, what I heard is that they don't want to look at subcontractors to do the work. They want to be sure that they're all under the umbrella of Eastern Oregon CCO. I think that's what they're thinking, in saying, you know, we want everybody to be one CCO, all the services under the CCO, and hold Eastern Oregon CCO accountable for that, for any services provided to Oregon Health Plan members.
Not Advantage Dental though? Do they see patients outside of?
Who?
Does that make a little bit of
Advantage?
sense?
Outside of this CCO?
Yeah, the bill, we
Or
have one
statewide?
CCO in the Portland metro area who doesn't have all the responsibilities, and they always say, well, we subcontracted with this organization to do that, and OHA wants to be sure they have teeth in the contract that's signed between OHA and the CCO, and they want to be sure that the CCO is responsible. There's no pointing fingers to subcontractors or providers.
Okay, thanks, Estelle, I haven't heard that, the reasoning behind it.
Yeah,
I
that's
just-
what I have heard there. So they really, what I heard Lori Poyer, she is the Medicaid director. She said one of the first things that our director Alan wanted was to be sure that we're following the contract to the letter and hold all the CCOs accountable. Because what it used to be, unfortunately, is if staff liked a certain CCO, they would not follow the contract, and so they want to be sure that it's consistent and fair to everybody.
Thank you. And then the last one is governance and structures and roles of CACs. There's some changes there. On our org chart, we're supposed to have a CAC nominating committee. We didn't know what that was for R12. It's usually at the local level, you know, so that's a change. The other change, we already have the Regional Community Advisory Council chairperson who is on the EOCCO Board of Directors, but there's also going to be a requirement that an Oregon Health Plan member be on the board as well. Now, Katie actually fits that role both ways, but you can't guarantee that, right? So you have to have space on the board because her son is an OHP member and has a long-term disability, so. But anyway, so that change will happen there. Patrick Mulvihill will be handling the media communications. We will need a point of contact here locally, either Susan or somebody, where it says we need a local point of contact for the media. So when we send our press release to the Examiner, you know, if there's a quote in there that Patrick's writing and making you sound brilliant, we want to be able to let you know ahead of time that, what? You know how it works. So Susan for now?
She's not here.
Yeah, she's not
Yeah,
here.
let's volunteer her.
Well, she's chair or vice chair.
Yeah, she's not here, so we'll say yeah.
Well, I'll connect with her then, but we'll need to have that identified for Patrick to work with. We will have posters made up and distribute them, so hopefully we can get them in clinics and things like that around town. You know, you had mentioned the webinar for North Lake. Yeah, I mean, I wish that we could do extra meetings, but I just don't see it happening, not with the 30-day notice, not with, you know, just a number of things. But you guys have a Facebook page, right? Okay, so is that through Healthy Outback Strong, or is it through the CAC itself?
No, Outback Strong has one, but the Health District has one as well. And Julia Ugalbi is our marketing guru. And she's really good about posting in all the places. So there's a Christmas Valley Facebook page that everything gets shared to. There's one in Paisley, so she will get the word out.
Okay. Any other special ways of communicating here besides, you know, public media and Facebook? Does radio still do anything?
Yeah, there's 2 radio stations that get that a lot of people
Kids do
listen
anything?
to.
Or kids?
Paisley and Lakeview.
Anybody?
Yeah,
Well, I guess there's 2 radio stations in Lakeview.
there are 2 radio stations in Lakeview.
So they're not all electronic though, right? Where there's not actually nobody in the building?
No,
Like
they've
the
got
one
real life
in
people.
Malawi County? They talk to people?
Yeah.
Okay.
Yeah.
So maybe Susan would be asked to be on
Yeah,
that.
Paisley'd be a good one
Yeah.
to reach out to too, because they're always looking for stuff to fill their time. They're really good about that.
Desert Whisper is the publication up north, the Parks and Rec District does, Christmas Valley Parks and
Yep.
Rec. And they only, is it once a month that they publish?
Yeah, and Community Breeze as well,
Yes.
but
Desert Whispers is twice a month.
Okay.
Is it twice a month? Okay.
Cool, but they're, yeah. That's a good one.
Okay, I got that. We're gonna need the meeting location, that's here. Food, normal stuff, but have more cookies and snacks available, and whatever bill comes to that doesn't come out of the LCAC admin, it comes straight to me.
Yeah, we can have a nice break.
But the CACs that usually have a meal, like eat over lunchtime, we're scrambling to try to make sure that whole meal is available for people that do that. And then it says, meetings may be recorded. Patrick, our communications person, is required a week after the meeting to talk about what we did for outreach, who we targeted as partners, which we have a big email list that we'll be sending to everybody, and who actually came and what comments and things were made at the meeting and concerns. And we have 1 week to get that back to the health authority. But if he's not there, some of the people that I work with, I would be comfortable, you know, being able to do that for Lake and the places I work with. Some of our other people just didn't want to be able to do it without having a recording. So we will announce that, and no comments from anybody will be attributed to anybody. It would just say the concern was X, Y, and Z, not, no, Dave says you need to pay us more faster. And we're all set here with the electronics, so it shouldn't be a problem if people come with a flash drive rather than, your system, you don't have restrictions, your IT people about that?
Not that I know of.
I don't think so.
You're pretty set with that, yeah.
Okay. Well, thank you for the input. We'll need to share the minutes of September with the health authority that say that we discussed this.
Okay.
Am I forgetting anything, Estella?
John, you did a good job. It was also very thorough.
Thank you.
But did I hear what some of the concerns are for Lake County they want to bring up? I perhaps missed that.
Well,
the funding for mental health now.
But that's on the agenda, right?
Yeah, that's
So,
on the agenda.
one of the concerns that I have written down here is availability of healthcare workforce.
Yes, I think that's everywhere, but for sure.
Yeah, but you know, Stella, correct me if I'm wrong. When we started the CCOs were basically told not to get into workforce development, that another part of the health authority was working on that. But now I'm seeing little blips that say you can work in workforce for 2.0.
But especially there's a shortage of medical providers in so many rural areas, and we lack specialty, specialists to provide that service. So I think we just need to kind of pay attention to that and kind of see where that goes in the future.
Okay. But yeah, I mean, I think we can address some of that through other resources that are available at the state, through OHSU's Office of Rural Health and their recruitment and retention programs, you know, and if we could link up and there's potentially we could use them in their screening process to identify candidates who want loan repayment and then say, we'll pay for 2 more in Eastern Oregon or something like that in terms of their loan repayment. But we'll have to work through that as a potential. So that was the only one, Estelle. Just not enough workforce, especially for high needs patients.
Primary care and
Right.
dental.
Right.
Thank you, Paul.
You bet.
And mental health,
Yeah.
Pretty much all the areas.
Mhm.
And that's it for me. You got the budget for the admin funds.
Yeah, so during the last CHIP meeting, Paul had informed us about the LCAC support fund request process. So every year around September, the CAC has to approve on this, on the request where we would like the funds to be used for, what kind of activities. And this form is in the packet, the meeting packet that I had handed out. And there are, if you see, there's a table that also shows, so $12,000 is the amount that the LCAC will receive. And in the table, if you see the categories, there are various categories where we can say the money will be spent on, or that will be the category that will use up a portion of the $12,000. I've had a small discussion, and so far, what I have come down to is to have some funds for the food items we provide for the monthly meetings, to put aside some dollars for the meeting support and supplies that we hand out. I did not get a feedback on the other categories as much as for translator or health and wellness media support. And the last two categories that we sort of felt we could use the money are the last two items, the stipend for the LCAC meeting coordination and the stipend for the coordination and reporting of the incentive funds. So four categories up till now the discussion has been. Paul informed me today that it would be, we should also think to keep aside for some money for other expenses if any LCAC members go out for trainings or attending some conferences or meetings, and if they're not going to get reimbursed for that, we can use the other expenses category. So far that's all I've heard. Do we want to, are there any comments on that or some other category that I have not mentioned?
Can I ask a question? I don't know if it's a you question or a you question, but if we do put training money into other expenses, but nobody needs to go anywhere for training, can we then move it at the end, or does
Yes.
that, okay?
Right, and you know, the one that most people want to do is that Innovation Cafe. It's typically in Salem in June, and you know, it's lots of very short and intense presentations and discussions, so you get lots of coverage, and it's not like you're listening to the same subject for an hour and 15 minutes. You get 10 minutes, 15-minute chunks of what people are doing in order to achieve the triple aim, or mainly, what do you do to meet incentive measures?
That works for my ADD issue.
So I mean, if you just mentally thought mileage and a hotel night over in Salem, because the meetings are typically free.
What is the stipend for coordination and reporting of incentive funds? How have other counties used that?
Well, if the LCAP gets, well, you guys are eligible for the $41,190, right? Depending on what you use.
Right.
And every 3 months or every 4 months, Christie has to take time, collect data, to send in a report to the Practice-Based Research Network that's reviewing those. She doesn't really get them for the opt-ins.
Yeah.
She doesn't get, that pay does not get recognized when she does an opt-in report. But for the LCAC funds, it's just to recognize that there's an additional administrative burden on somebody that we put there.
It's the cat herding fee.
Yes, I understand that.
Does that make sense?
Mm-hmm.
I mean, we just want to recognize it, because I can tell you, some of us weren't real thrilled with that, but it came from higher up than us.
It's good to recognize that that's a burden.
Thank you.
Can you specify as to where that came from exactly?
Where, what?
Just what you were talking about, I mean, where exactly?
The scrutinization of the money at the board level, sir.
At the EOCCO?
Yeah. Through a subcommittee that I sit on.
Okay.
That reviews all of the activities, makes a recommendation to the board. And generally, I know you only had one board meeting.
Yeah.
Generally-
I'm on the board, I just don't remember any of this.
Generally,
It's the first time I'm hearing of it,
well,
sorry.
generally, it's, you know, it's pretty much, if this committee recommends it, there's no discussion at the board, but there is a motion and a vote on it. But it's usually done before it gets there. My problem is, we're talking about $390 million budget, and we're scrutinizing very hard $742,000. That's what goes to the LCACs. So in the beginning, when the money went out, I think people were worried that people were just gonna not do it. And I said, they're gonna do it, you know, but they wanted more oversight.
Paul, can you elaborate a bit on the EOCCO OHP membership engagement activities, if any other counties have?
Yes. So this is important here too, right? Because we don't have Oregon Health Plan members on this group. The other place that was similar, where you had a community health improvement partnership, was in Morrow County. And then it kind of blended with the CAC, with the CCO requirements. Well, the CHIP was already in place. You know, it did not have a requirement that OHP members be 51%. And in those two places, it's been a struggle to get to that. So, I mean, if you were to budget for it, it would be to have a luncheon, to be able to have members have a $10 coffee card so that they could take somebody out to coffee and talk with them about, you know, this group and why it would be important for them to join and talk about the health plan that they have. There's been a couple of different meetings that way. A display booth, that if you were gonna have something at the fair that would talk about, you know, those trifle things you put on a table. It's just, you know, it's the cost associated with, you know, promoting the camp.
Don't we already get some dollars for OHP members if they attend the meetings?
If they attend the meetings, yeah, they're, I mean, if an Oregon Health Plan member attends the meeting and they sign up and get recognized by the county court that they're a member, they're eligible for a $35 stipend to attend the meeting, mileage to the meeting, and child care expenses.
Okay.
That money does not come from this budget, that comes from me.
Did other counties advertise that somehow? I mean, that's,
I don't think it's advertised at all.
is that something that maybe should be? But put the word out that, hey, we really want to hear from you, and this is, not this is what you get out of it, but
Harney's been doing it, I mean, and they put that under health and wellness media support.
Okay.
So that they could buy an 8th page ad and put what they wanted in it. Rather than hoping that the press picks up on
right.
your need.
For us, it could be wise buys, just thinking of what people aren't subscribing as much to the paper anymore, and the wise buys is free for people to pick up. That might be what we're doing.
A lot of people read those Lakeview lowdowns, though.
That's true.
They read
That's
those
true.
even up north.
Mhm.
Well, if there are no more comments or questions, should I take a vote?
Well, this needs to be reflected in the minutes that the group had a chance to discuss and approve this agenda and budget.
I move that we approve the 2019 Local Community Advisory Council Support Fund Request process.
And that will be for the healthy meals for the LCAC meeting category, the meeting support and supplies, the stipend for LCAC meeting coordination, stipend for coordination and reporting of incentive funds, and for other expenses. These are the categories we all are in favor of.
The other category, the other expenses is the potential for travel. To the meeting.
And you said we can move the funds if they are not being used. For example, for the other expenses category, then we can move those funds to some other category?
Yes.
Okay.
Does that cover everything that you want to put in that motion?
Yep.
Anybody else?
We had a good motion, but we haven't had a second yet.
Yeah, do I have a second?
Darwin's got the second.
Darwin's gotta go somewhere.
All in favor of using the LCAT support dollars for the mentioned categories, say aye.
Aye.
All those not in favor, say the same sign.
I really think the outreach to OHP, somehow we need to get more OHP involvement. Otherwise, it's us making decisions for people who don't have a voice. Sorry, I will be the problem child.
No, you have a point.
Every group needs a rebel. I thought that was you, Will. Turn over to her, Dick.
So are you a nay as well?
No, I said aye, so.
You can change, it's okay.
So I will add the category of OHP and EOCC membership engagement activities to the categories I already mentioned. So do I have a motion for all those categories, including the membership engagement activities?
I'll move that.
Do I have a second?
Second.
So all in favor for using the LCAC support dollars for all the categories we have discussed now, say aye.
Aye.
All those not in favor, the same sign.
Somebody would change their mind.
Okay, so the motion is approved, and
Submit that by the end of the month.
I'll do that. James, were you the second?
Yes.
You seconded the, okay. Thank you, everyone. Next, we'll go to the next agenda item, the CHIP updates. We have had sort of an eventful summer with thankfully not too many fires close to Lakeview and Lake County.
I know of one big one.
Close by? Close by? Oh.
Yeah, on Roberta.
I get it now. So my first update is about the Living Well classes. We just got done with the Living Well classes for chronic conditions. And that has been our most successful Living Well class. We ended up giving completion certificates to around 12 participants. And thanks to the facilitators who have done such a good job with that class. This week we started the Living Well with chronic pain class. The turnout wasn't as good compared to the chronic conditions. We are hoping from next week we will have a higher turnout than what it was this week. The summer food program went well. The summer food program ended on August 23rd. It was a sort of a 2.5-month program, and this is the third year we are doing the summer food program in Lakeview. I think this has been the best year. We crossed more than 5,500 lunches that we handed out. Yes, and it's definitely one of the popular programs in the community, and we didn't even have to advertise much. We just saw a good turnout from the first day.
I'm sorry, Urban, just a food update that I don't know if Christy was on the list or not. We did not. We applied for a USDA food grant, Gus Shoemaker. We did not get it.
Okay.
And Lake was going to be a participant in that.
Is that the Veggie RX program or that's different?
It was to expand the Frontier Veggie
Okay.
RX activities. Yeah, we didn't get that, but apparently there's now a Walmart one that we're going to go after. The letter of intent is due 17th of this month, and then they invite you, based on your letter, to submit something.
Okay.
Which is actually a nice way, Christie, you know, because you pretty much know that you're in if they invite you to submit. Rather than writing the whole doggone grant up and not knowing
Right.
that they're even interested or not.
I'll let John know, we'll support whatever he
Okay.
needs.
Our next update is about the plans for installing a play structure. So there's some bad news with that. So originally our plan was to use the funds and install the play structure in the Sept Park. And the town of Lakeview was very helpful with us during our steps. So later what we found out was that the Sept Park is owned by an agency called Pacific Power. And we had to get their permission before we could get the approval to install the play structure. However, Pacific Power has other plans with the park. They're right now working on selling the land. So because of that, our whole plan got derailed. We have a meeting next week where we are going to decide if either we want to change the location or we want to use the funds for something completely different. So that's the update on the play structure.
So those were LCAC dollars?
Yeah.
Not in any kind of opt-in, those were your dollars, and they can be reprogrammed if needed.
Well, and you sold it for us. I'm assuming that you were the one who advocated so hard for us to get that because you had said that the CCO
I was on the committee, yeah, they were
Well,
worried about
yeah.
liability if the thing started falling down, and then that's why you talk to the city, because they would be the ones who would agree to maintain the structure if it was bought and put in. But apparently they don't own the dirt, so we're gonna have a floating playground.
Well, and the idea and what helped, my understanding of what helped you sell it was that we wanted that park to be a place where families could be active together, and there's stuff for adults and older kids to do there, but not so much the littles, so.
Yeah, I had argued that social determinants of health built environments was,
Yeah.
and it was actually part of our focus group from the summer. People talked about that in Lakeview along with the water quality.
Yes, can we put it toward water quality? Invest that.
We're all
Next-
looking at you, Darwin.
Was there a way to just switch parks? Because I mean, you know, like the pool park doesn't have any play equipment, and it's it'd
Explain
be
the
nice to
drop
have some
zone.
out there.
So we thought of other locations. So definitely the McDonald's park just doesn't have place for another play structure. For the pool park, one of the issues we came up with is that it has a slant, pretty steep, and so that will cost us way more, I guess, to set up the play structure. We did have some of the grant money placed aside for the installation fees, and yeah, it's just going to be more complicated at the pool park area. Then we are also thinking about locations near the school. We have the baseball court and the football court, so there's some area in between that. But we weren't sure how popular that site would be.
It's not really a family hangout.
Yeah.
Be active together site was kind of where we landed on that. Like you've got your kids playing, you've got your parents watching, and probably the parents would love to have somewhere where they could send the littles to go play while they're, you know, so they're not running around and screaming around dugouts, but it go at the heart of families being active together, so.
Yeah, the area doesn't even look like a park.
Yeah.
So, yeah, but we have a meeting next week. Hopefully we can come up with some good solution to that. Next update is about dental screenings. So folks from Advantage Dental are in town. So they were doing dental screenings on Tuesday and Wednesday this week at the ADA school. They're gonna be back next week. So we also have an open house event at the North Lake School next week. So one of the stations for that open house event is going to be Advantage Dental. So they're going to be there, and I guess later next week they're also going to do dental screenings in Paisley, Adel, and Plush. So that's going on. It's time to start having discussions about the teen health fair we'll be having this year. From past discussions, we had decided we will do it on November 13th at the Daily Middle School gym, where we have been doing it most of the times. I still need confirmation from the principals, but as of now.
November 13th?
Yes,
Got their boss right there.
What day of the week is that? Oh,
Wednesday.
Wednesday. Yeah, but I'll keep the council update posted with how we confirm on November 13th and how it goes. It'll be similar to last year. We'll have around 10 stations, clinic stations, and just normal educational stations in the teen health fair. We are gonna try and see that if we can bus students from Paisley again this year. That went really well last year.
What time?
So that's another thing we need to confirm on, but so far the idea was we'll do it similar to last year, like it'll start at 1:30.
So 6 through 12, yeah?
Yes.
Okay, then 1:30 is the time you want to do that.
1:30 we want to start around when the school gets
Yeah.
over, and it might go on till 3 or 3:30.
I'll let my principals know.
Thank you.
So just a quick comment on the dental screenings and those are the ones in school, right?
The ones that are happening now, or for the
Yeah.
teen health? Yeah, those are
Okay.
in school.
So in Condon, Arlington, and Morrow, M-O-R-O, Advantage has begun to implement its teledentistry project. So advanced practice dental hygienists are hooked up with OHSU's School of Community Dentistry, and they can do the assessments. They can scoop, but not drill. They can fill with stuff. And it's all portable. They have their own hotspot, so, at some point, maybe we'd be able to get, as this system expands and they work out the kinks this year, thinking about, getting out the flush for a day, or something like that, so.
The last update I have is on September 21st, there's an event being planned at the Senior Center. And this was planned from the Older Adult Collaborative, which we also meet once every month. So we have been working closely with Klamath on the Village Initiative. The idea is to have volunteers, community members who will volunteer for helping out seniors with small tasks like getting, it can range from helping them with their groceries or shoveling snow out of their house to anything. So we have been working on setting up the Village Initiative in Klamath and Lake County for a couple of months now. In the past few events and fairs, we have gotten some volunteers who have signed up, and also seniors who have shown an interest, where if we have volunteers, they have some services where they will call us and let us know. So September 21st, we are planning to have the event on Senior Center, where there'll also be presentations and small stations where we will advertise about what the Village Initiative is, and there's going to be an opportunity for people to sign up as volunteers, or if they need some help.
So let me ask something. If I had an elderly parent living in Lakeview and I called the senior center and there was no Village Initiative, and I said, my mom needs help with groceries or something like that, they wouldn't already help people? Is this an expansion or something new?
It's new. Senior Center has some resources that they provide, like if somebody needs transportation.
Right.
They provide meals at the Senior Center on certain days of the week. But I guess for all other tasks, they are severely understaffed.
Okay.
Yeah,
I just kind of assumed that was
Yeah.
part of,
No,
that
they
they
don't
were a
have,
resource
they don't have
for
the staff
elderly
to
people.
help us at all.
Okay.
No.
And it's
We
also
had
going
a
to,
navigator.
we don't have one anymore.
No,
No,
Because the
Nope.
funding was lost. So at the moment, we don't have a senior navigator or patient navigator.
No.
the event on the
How's that?
21st is also a fundraiser for the Meals on Wheels program. To try to raise money for that, because that program is pretty much bare bones, barely scraping by.
Okay.
As well as to learn about the senior center, what they offer, and the village. So,
Which,
And the dinner's at the Elks.
yes, dinner.
Right.
Village is a national model.
Oh, I know, yeah.
Yeah, and the reason we've been pushing it, it's the Council on Aging, Klamath Lake County's Council on Aging is the agency that's spearheading this. And so they have a Klamath County Village, but they also have the Lake Village, which is the Outback, whatever we're calling it, the Outback Village, something. And the idea is to get community members watching out for each other more, is the hope behind that. So if you are a carpenter or a contractor or just somebody who likes to talk, then you can sign up for the volunteers, and everybody's entered into a database is how it works. So I say, these are my skills, X, Y, and Z, and then when a senior pops up who says, oh, I need this thing, they match you to someone who can help you.
Okay. How is that different than, what was it called that you guys did here, gatekeepers?
Gatekeepers.
Where people are watching out, like if the older person comes in, that you can tell that their banking is not right or something?
Yeah, that's the same, I think.
It's pretty close?
No, that's you call a hotline and then ADRC investigates.
It's just
The purpose of that,
recognizing
yeah.
potential.
Oh,
I didn't know anything about
like
that.
people at the store? Yeah, okay. I'm sorry,
I'm a senior, don't know what's going on.
I'm getting there, but I'm not real knowledgeable.
Don't get me started, no. Sorry.
Those are all the updates I have for the CHIP updates. Next we have the grant updates.
Right. So first, actually, I'm gonna talk to you. Do you want to talk about the opioid grant?
Sure. Okay.
Let's put you on the spot.
So we did receive a $200,000 opioid grant last year from HRSA, which is a federal entity, and we were supposed to finish our grant deliverables and objectives by September of this year. But we had a very large focus, and this was a tri-county project. We were working with Modoc, Klamath, and Lake, and we had hired an outside vendor to do a community survey, where we had 1,200 surveys for every county sent out, and that vendor got all the responses back, and they put a nice, good survey report for us. And doing all of this in addition to the other deliverables, we were not at all in the timely fashion on how we needed to do.
We didn't get the reports until last month.
Right, so it was not all on us. But so we were able to apply for a no-cost extension, and we have received an extension until July of next year.
End of June.
End of June. End of June of next year. So we will be continue to work on the deliverables, but I think that towards sometime next year, we may be able to share our community survey results with everybody, and we are planning to do at least one information session by December of this year, where we want to share the results that came from community surveys, and also take a little bit of feedback, if possible, from the community on the opioid use and the substance use disorder and their perspective of that. So, and in this process, we're also going to look for hiring a project coordinator to help us meet the deliverables. So at this time, we are working on the job description, and we'll be posting that job. This person will be working between Klamath and Lake County, because Modoc County received, they applied for an opioid grant themselves, and they were awarded one, so they are not a part of our project any longer. So we are working on getting a project coordinator onboarded by October, and then they will be splitting some time between Klamath and Lake. We have 5 big deliverables that we have to submit to HRSA, which includes a needs assessment to be done, a strategic plan, a workforce assessment, and
Sustainability
plan.
And the MOU was the first one. So we have one.
So we have a bunch of other work plans that we are working on. So we meet once a month. It's a consortium meeting where we have some Klamath County representatives on the call, and then we have some subcommittee work groups in Lake and Klamath that is meeting outside the consortium meetings to work on all of these workforce plans. So I think it's very exciting what we'll be able to do. And once we have all of these plans and results and outcomes together, we may even apply for the implementation grant, which is a part 2 of the planning grant, since this was just to use the funds for planning on what we can do.
How does the workforce look for treating and helping opioid addicted people in Klamath and Lake.
Are we going by the official, how many people have OUD and are in services? Because officially Lake County has 3 people diagnosed with opioid use disorder.
Well, I mean, obviously, the reason why all the money's pouring in is we know that people are addicted to opioids beyond the ones that are getting treatment. But I mean, if somebody was looking for treatment, do we have medication-assisted therapy
Yes, we do
available
have.
here? Do we have, what's the drug the doctor's Banzidine or something?
Suboxone.
Suboxone, yeah. So somebody's here is qualified to manage people with that?
Yes, we have multiple practitioners between Warner Mountain and Lake Health that can take care of that. But one of the things in the needs assessment that we identified is we have to work towards identifying the patients or the community members that are struggling with this disorder. Because right now, as she said, we only have 3 official diagnoses of 3 people who have the opioid use disorder diagnosis. So it's a lot of work in front of us, but I think we have a good plan in place for that.
Well, how many people have had naloxone shot up their nose from overdosing?
I think we did a survey of the law enforcement, and I was surprisingly, it was a low number. It was not as high as we were expecting.
Was it more than 3?
Yes, I think so.
Okay, then we know that.
It could be the same one over and over. You don't know.
Yeah, that's true.
Okay, so that's opioids. We also, last week, we submitted an application to Oregon Housing and Community Services. OHCS has a permanent supportive housing technical assistance cohort that begins this fall. And in a nutshell, if you want to be eligible for the state dollars, the $20 million that have been set aside for permanent supportive housing, you have to be part of the cohort. So we should hear next week about whether we've been accepted. We didn't know until the Wednesday of Fair Week that we were eligible. So an application has to include your service providers, which we are swimming in service providers, as well as a property manager and a developer. And we found out there was a local developer interested in permanent supportive housing. So that project, we're looking at, we hope, a 9-unit project, 1 unit set aside for the on-site case manager. It'll be the other 8 units, it'll be 100% permanent supportive housing with 2 units set aside for people with severe and persistent mental illness. And then we have people with substance use disorder who could benefit from supportive housing. We have some units set aside possibly for veterans. DHS signed on as a service provider partner, so we're looking at your self-sufficiency clients specifically and who might need some extra support. At least 2 of the units are probably going to be ADA accessible, and so just fingers crossed that we hear this. OHCS made a big deal at the Oregon Housing Conference that James and I attended last month about, they went on a listening tour and they heard they were not doing a very good job in rural. And so they are trying, to their credit, they are trying. This cohort will meet from, it's either October, no, it's November through February, I think, maybe October through February. And they do require in-person attendance, mandatory in-person attendance at cohort meetings in Salem and Portland. So they still haven't quite grasped what it means for rural to be involved and traveling over mountain passes and whatnot. But it's still a really good opportunity, so we're hopeful and let you guys know. Also on the housing front, we're still waiting to hear from Meyer Memorial Trust. We applied for funding that would help pay for a developer and pay for a project manager specifically for housing. And even though that person would be devoted initially to this permanent supportive housing project, the hope is that they might want to stay on and address some of our other needs, whether it's workforce housing, or even something like a sobering center, which that was when we surveyed our law enforcement folks. We need to have a sobering center. We need to have inpatient treatment in Lake County. So looking at some of those broader projects as well. And we will hear, we had a really...
So the cohort, you know, it sounds like it's a learning collaborative.
Exactly.
But you've already got a plan.
But we're jumping through the hoops. We want some of those capital dollars, so we're gonna jump through the hoops.
Okay.
Yeah, Meyer, we had a great site visit with the program officer at the end of August, just a fantastic visit, so we're hopeful, but we won't know for sure until probably November whether we get that funding. And if we do, that kicks in January 1st, so. That's everything I know.
Yeah, you're just used to the rural, this is the frontier.
They have money set aside for rural in community housing.
Yeah, but correct me if I'm wrong, but isn't that entirely pretty much earmarked for permanent supportive housing?
I couldn't tell you that exactly. I just know that at a meeting.
Very little of it. I don't think
Was like
there's really anything that's directed towards transitional.
Oh gosh, no, not
Yeah.
like that. But rural and permanent supportive housing are 2 of the 6 priorities that were identified in the housing plan, the statewide
Right.
housing plan.
20 million or something.
20 million for permanent supportive housing, and I didn't see a specific, or I don't remember if there was anything for rural.
Thank you, Christine. We keep some minutes aside for any public comment, any comments or questions in general, if anybody has.
So Ravinder, our OHSU students, great to have you. Can you guys tell us a little bit about what you're doing, a little bit more about what you're doing, and how maybe some people in this group could help?
Yeah.
So we were contacted by the Extension Office to come and do a project on this framework called Blue Zoning, which is a health lifestyles program that's based on epidemiological data of looking at all of the cultures in the world, which is why anthropologists are involved, and looking at how different cultures live their lives, what diets they follow, how communities engage with one another, and based on this information, a best of framework was designed, and that's what Blue Zoning is called. And there's 9 different zones that are involved in this, and they range from everything from faith-based community engagement and family engagement, multi-generational living, plant-based diets or plant-leaning diets, as well as some other considerations for how do communities create belonging, and how these are the key factors that they found inform health, especially later in life. And the goal of this program is to push towards getting to 100 and having the highest quality of life towards the latter end of the life course. And so this framework of Blue Zoning has been picked up in Klamath, and they're interested, the community health workers here are interested to see if maybe this would be a good place to also pilot a program. So it is very in line with some of the stuff you're talking about with the CHIP.
Oh, yeah, Wallowa County, their CAC supports Blue Zone.
Okay.
So that's Enterprise up in the northeast corner, isolated. But yeah, I mean, they looked at where people lived to be 100 initially, you know, and then they went in and found it. It was just because the color of the mapping, GIS software, made it blue. The area blue, the older you were, you know, it was different colors. So that's where Blue Zone came from. But the highest one in the U.S. was Loma Linda, California, which is a high concentration of Adventist people. And
Out of curiosity, how many people have heard about Blue Zoning? Wow. Okay. And what do you think of it? Do you think that would be something like you could benefit from?
I think you can benefit from that. I wanted to ask you, do you have any health or community agencies in your mind you would like to reach out to?
We've really just begun.
Yeah.
This will be a longer-term exploration that will result in a report. But until we get our feet wet a little bit more, I'm not really sure where we're going with it or what we're going to deem necessary. At the moment, we're exploring all the possible domains that might map onto these tenets of the Blue Zone framework that are here locally, and then we'll identify the organizations within those domains that would be best to speak with.
But it is a pretty holistic approach, so it's everything from like fitness to home gardening to healthcare work. It's all encompassing.
Have you guys heard about the Food Co organization by any chance? Yeah. Okay. So we have a food court service member, we support them every year. So we have a new one for this term year. She again couldn't be here during this meeting, she has a training in Portland going on. But definitely once she's back, she'll be back next week. So I'm guessing I have all your contact information on the sign-up sheet. So what I'll do is I'll send an email to all of you. We can share some contacts and yeah, we can go from there.
We would really appreciate that.
Yeah. And you said you're in touch with the OSU Extension Office. Can there be the name of the person you are in contact with? Is it Jamie Davis?
She's not there. Well, she's.
Oh, she's not there anymore.
Yeah.
She's what?
She's traveling.
Oh, yeah, she got promoted.
Yeah, she got promoted.
So who's the contact person you guys are in touch with?
Oh, is it Jean?
Jeannie is the.
Jeannie's awesome.
Okay.
Yeah,
Okay.
she's one we've been dealing with in person a lot, but the extension agent, or the extension office is our base right now, so you can find us there physically.
okay.
So you just.
For how long are you there?
The next 11 days.
Until the 22nd?
Yeah, 22nd.
But our, you could say like our director of the project is Sarah Cunningham from
Okay.
OSU. She member.
Okay. So it's only 11 days. Do you guys already have a plan for next week? What you're
No, we're working on that now. Do you have any ideas? Other than food court, which is a great one.
Yeah, I think the discussion will be very long, and I feel our meeting will be ending in a few minutes. So why don't I reach out to you guys and we can discuss, and I'm sure there'll be ideas. Yeah, community health is a pretty broad. Yeah, I'm sure something we can find. You said plant-based food is also one of the, okay,
Is one of the 9 tenets of the.
interesting.
Also wine at 5.
Yeah.
That's an interesting one, yeah.
So there are what, 5, 6 of you? I didn't actually count. So
Yeah.
are you, did you say you're each choosing one of those, one of the 9? Is that the plan, or do we know?
More or less.
Okay.
We might be broken up differently by theme.
Gotcha. Because that would help you to narrow down the, who you can refer them to.
Yeah, if you're working as a team or not.
Yeah.
I haven't drilled into blue zones, but I'm just curious, you mentioned interconnectedness of people, and we do have a lot of social isolation in Eastern Oregon. I'm just wondering what tools you guys might be looking at to use to measure how do you measure the connectedness?
Well, and that's kind of what we're here to figure out, because it really depends on the area that you're in. Like, it changes, and how you measure that, I think, depends on what we're looking for, and we're figuring that out right now.
Okay.
So,
Are you guys looking at the county or at Lakeview specifically?
Lakeview specifically.
Oh.
Yeah, so I'll reach out to all of you. I'll send you an email just introducing, and yeah, I'll also go over other contacts I can think of that would be interested in working together on this plan you guys have. And yeah, so let me do that, and let us have more discussions over how we can go over it.
I just have one question, I'm sorry. I was just wondering, when the Advantage goes into the schools and does screenings, what happens with that information? So if my kindergartner, I don't know, 4th grade or whatever, gets a screening, and they determine that, ooh, there's some problems, what happens with that information? Does it go home in a note to mom and says, are you on the Oregon Health Plan, or what happens after that?
They would know if you were on the Oregon Health Plan.
Yeah, so what I know about
Because you would be
is-
assigned to Advantage, and Advantage is doing the screening.
Right.
But they screen everybody. If they're not OHP,
Right,
then the
right.
vote goes home. But again, screening and treatment are 2 different things.
Oh, I know, that's what I mean.
There's
I'm
passive
wondering how
consent,
many
there's
of them
passive
that
consent for them to
home
look
and
in your
nothing
mouth, but you have to have active consent for them to apply fluoride or the dental sealants.
Yeah, so we have consent forms before we can carry out the screenings.
Okay.
The treatment they provide free of cost is the dental sealants.
And fluoride.
And fluoride, and it doesn't matter if you're OHP member or not. For everything else, after the screening, they do contact the parents and let them know that, hey, they have these many cavities or something, so if you have a dental provider, you should, yeah.
Okay, so they do that step for everybody, whether they're on the Oregon Health Plan or
If you sign up for it.
not. So a note comes home.
Yeah.
I say, oh, yeah, why not do this, okay. And then, so at any point though, is anybody encouraging those that aren't to, are they helping them with the process of applying for it? You know what I mean?
I didn't
Yeah.
understand that question.
So I'm not on the Oregon Health Plan. I don't think I'll qualify. I work, whatever the situation might be. Is anybody encouraging that to take place or coordinating that?
I think that has not been fleshed out. Yeah.
Well, Judy,
But I
go
was just
ahead.
going to say, I know with our new agreement with the schools, that we are going to, they're going to have a referral to us privately of parents that they think we should go offer. You know, they had talked about a booth, but people might be uncomfortable coming up and asking about information. So we're going to depend on the school to give us names of kiddos that maybe we could reach out to parents and see if we can help them.
I think people need to see the numbers, because I think it's, a lot of our programs is a little bit higher than what they envision. So once they see the numbers, they go, oh. Okay, thank you. Sorry, I was just curious what happened with it.
I have one quick update that's not really an update. CLASS, the Klamath Lake Community Action Services, is they do energy assistance, homelessness prevention, et cetera, et cetera. They are, as far as we know, moving forward with having a full-time position in Lakeview for real this time. And is it Friday, next Friday, that they're gonna interview some people, so they were asking, they wanna have 2 class people and 2 people from Lake County to sit on this interview committee. So we have a few people who have volunteered.
That'll be good, yeah.
Since it's
I think
energy
they only
assistance
had
time.
2 applicants from Lake County apply for the position, or for that full-time position.
I didn't want to go.
There was over 30 people.
I was having, when Dave was ending so good, and then you spoke. I'm just so sad now, I had a feeling that was
Don't
going
know.
to happen.
Do you know how well it was advertised?
Not really.
See, I was going to say, I don't think it was advertised in Lakeview very well
Yeah.
for people to.
Last time I heard when I spoke to class, there was only 2 people that applied from
Right.
Lake County. There was over 30 people from Klamath, but
So
those
then I
people
wonder
probably
where,
will not
yeah.
be.
Well, but
All right,
that's
they
where it
want
was
someone.
maybe advertised. I mean, I don't know.
It's one of the issues
Yeah.
that we're kind of working through with class, where, you know,
Yeah.
I specifically, word for word, told them that I'm in support, and I think that Lake County is in support of class having a presence in Lake County, but I think it needs to be a little bit more lake in the name. You know,
So hopefully
maybe
it's
a
two
lake
good candidates
class.
that are applying.
Tell them,
Yeah.
tell them.
Yeah. Was that
It's-
like a couple weeks ago that you heard that number, or was it yesterday?
Last week. So, and it was still up on the website when I checked.
I did too this morning.
Yeah.
Yes, I
So,
did.
and she's leaving it up, but, and I even posted it on Facebook, I posted it around saying, hey, position's open, it's a job, it pays $16 an hour.
Well, initially when
Yeah.
they posted it, they didn't have that on there, so I called and
It
said.
was a little confusing on the website too.
Well, because I think it was less. It was less money than that, and then
Yeah,
they changed it.
then they raised
Well, even at 14, they didn't have anything, so people
Yeah.
were assuming minimum wage.
Yeah.
What is the website?
Klamath Lake Community Action Services.
I think it's just KLCAS,
CAS?
yeah, .org.
Yeah.
Okay.
Yeah, thank you, Christy.
It's a big one here.
There.
So I'm sorry, I think we have gone a bit overboard. Meeting time. Are there any other comments or questions?
Can I make one more? No? Anyway, the previous comment I made about my eyes closed at the meeting with the commissioners, that was because the politicians were here from Salem. Not because of the commissioners. No, I mean, you know,
Understandable.
yeah, understandable. I wanted to clear that up. The commissioners aren't boring.
No, we were very excited.
Well, I didn't say that. It didn't keep me going, didn't have me go to sleep.
It was legislative updates with Senator Linthicum.
Yeah,
and
yeah, it
Representative
was
Finley and
kind of,
Representative
you know.
Reschke, and also our new representative, Iverson.
who took the northern part of the county.
Yeah, she was disappointing because, I mean,
It's okay.
well, no, only because, you know, I mean, it's like, you know, she was brought in and, but didn't have anything to say, you know. She's still learning.
Just got there.
She's still learning, but I was hoping that,
Vicky,
I
Vicky, I
It's a really weird district though.
yeah,
And honestly, she represents the north end of the county. Her
Oh,
district
okay.
does not touch Lake.
not us, oh,
But she, well,
that's it, no.
she just got there.
Yes, I'm not
Okay.
trying
Yeah,
to,
she didn't
I'm
even-
not,
she
yeah, I'm not
wasn't
trying to
even
come down
involved
on
in
her, I
the
just say, you know.
process.
You're digging a deeper hole.
I think, never mind, I'm finished.
Thank you, everyone. The meeting is adjourned.